Hi, I'm Donna. I'm a physical therapist, but I'm also the director of the rehab services here at Presby Flower Mound. And today I want to talk about some safety things we have in place here at our hospital that we want to make sure you're aware of and that you're using with your patients. So let's talk gait belts first. We have two sizes of gait belts. The first size is just our regular gait belt that we use with most of our patients, and these can be found in any of the storage closets on the medical and surgical pods. But if you look at this package, this is what the package looks like. So to find these are usually on the top shelf in those storage closets. Okay, so these gait belts, to put them on, if you'll notice, there is a tag on these. So the tag always on this particular brand goes on the outside. Sometimes you kind of have to wiggle the little belt buckle a little bit to get it in place. But remember to put the tag on the outside, and when you're getting ready to put the belt on the patient, you'll just slide it around their waist and be careful to look for lines and drains and any incisions. If there are any of those items, you can always move this belt up higher. But most often it goes around their waist. So to put it on, tag on the outside, run the belt loop through the teeth, and then cinch it up on the patient. And then you'll take it and run it through the other side. Okay, so that's your regular belt. And the thing with the belts is when you are using belts at the hospital, we want to make sure you're using them on every patient. So if you are in a room getting a patient up to the bathroom, grab a gait belt. We need a belt on the patient. You never know what can happen. They can have syncope on you, or they might need to sit, or anything could happen. So always use a gait belt. If you're a sitter, I insist that you use a gait belt also. Just make sure you have one in the room ready to go. And oftentimes, if you're walking patients in the hall, let's make sure we have gait belts on them too. Now, when you're done using the gait belts on the patient, we have hooks in the rooms. They're up over by the computers, and you just put the gait belt on the hook for the next person that can come in and find it. Okay? The second size are our bariatric belts, and these look a little differently. They're rainbow color. And to find these are not in the storage closets because they are special order items. But if you do need a bariatric belt, you can find them in the physical therapy gym. So just go in our gym, and inside the gym we have a closet. And these are located and they're labeled on the bins. So same thing, to put this on, you'll kind of get the buckle in place, and then tag also goes on the outside. And these are, for our bariatric population, so they're going to be a little larger, but same idea, cinch it up through the teeth, and then pull it through to the other side. Okay, all right, so now let's talk Steady. So we have a standing and raising aid here, and it's called a Steady, hence Sarah. And we use that with any patients that are not safe to get out of bed on their own. A lot of times you might consider maybe a Parkinson's patient or an oncology patient, someone who's has the ability to sit and come to standing, but they can't always weight bear completely on their legs. So they have to be at least weight bearing on one extremity. If they're non-weight bearing on one side, they can still, use the Steady. But it's a great aid to use when you have those difficult to transfer patients. And we're going to demonstrate it so it kind of makes more sense. So I have a model here today. And this is Kristen. She's one of our physical therapists here at the hospital. So Kristen, if you'll just come over here. All right, so let's say you've gotten your patient up. You want to get them to the bedside commode. So why don't you just sit there on the edge of the bed. And once you've gotten your patient up to sitting, and let's just assume that they're able to sit by themselves. If this is a patient, though, that you have gotten up and they can't sit by themselves, I would always have a second person in the room with you so that they can be standing by the patient. But to get them up with the Steady, two things. Two things for you to know, okay? Let's see if you can see me here. All right, so the Steady has brakes, and it has levers on it to make the Steady, the leg pieces either go narrow or they go wide. So levers for narrow and wide are here in the middle, so you can push to make them wide, or you can push the other side to make them more narrow. And that's just to accommodate going over the brakes on the beds, or to get them under the recliners or the bedside commodes. And then the other thing that you need to know, there are brakes on this. So look at the wheels on the front or the back, whichever. There are brakes here at the wheel area, and you need to push the most down once you've kind of secured this next to the patient. All right, so then we're going to get Kristen up just to demonstrate. So to move it, you have to undo your brakes, okay? There we go. Okay. Now, the brake kind of, we should go to the other side. You know, sorry. We're just in order for you guys to see us better, we're going to move this to the other side. Sorry about that. Okay, Kristen. All right. So again, we're going to have our patient sitting edge of bed. Okay, so go ahead and sit right there. Yeah, that's good. Okay. And if you'll notice the brake under the bed, when you're getting this Serosteti set in place to get your patient up on it, you need to be mindful of the brake. So if the brake is in the way, you may have to widen your leg pieces, or to get it, you know, where we're at this point, I think we can put it on the narrow setting. So you'll slide this as close as you can to the patient, and you're going to cue the patient to put their feet up on the levers, the little platform at the bottom. And then once you've got their feet sitting on the platform and it's up and close to the patient, you then put your brakes on. All right, and then let's grab a gait belt. Okay, this is important. You need to have a gait belt on your patient before you even stand them on this. So get the gait belt on. All right, and remember, tag on the outside. And put it through the middle here. All right. Then you'll ask the patient to grab the front bar. So by grabbing the front bar, they have a place to pull up against and also to kind of hang on to for balance. So at this point, once we've got our brakes on, we've got our gait belt on, then we ask the patient to pull up. And you're kind of assisting some with the belt if needed. And once you've gotten them as far up as they can stand, then you can put the platform, the little flappers down in the back, and you ask the patient to sit back down on those flappers. Okay? And a lot of times what happens with the flappers is the patient still feels a little unsteady sitting on them, so you ask them just to let their knees slide down until they touch this front piece. And then they feel much more secure by doing that. Okay, so now we're ready to transport the patient. So then you undo your brakes. Now always have a hand on the gait belt, okay, or have your aide, whoever's next to you, assisting. So you can hang on to the gait belt, and this slides pretty easily. And we're going to put the patient on the bedside commode. Okay, so you just back them up to the bedside commode, and we're on the narrow setting for this. You know, once you've got them kind of in a place where you can let go of the belt, you can do that. But then you put your brakes back on, okay, and then we reverse the process. So we ask the patient to come to standing again, move your flappers, all right, and then they come all the way down to sitting. And they're on the bedside commode. Now, if you need to, just to, you know, make it more comfortable for the patient, you can always move this away from the bedside commode. Just have them lift their legs off the platform, and you can take this away while they're on the bedside commode. Okay? Now, we'll get them back up to the bedside commode, and let's say now we want to sit them in the recliner. So, feet back to the platform. Put your brakes on. Okay, and just so you know, the recliners that we have here at our hospital, this will fit underneath those recliners. Those leg pieces slide right underneath. So it's narrow setting, and they go comfortably underneath there. So we're going to come back to standing, and then pull your flappers down, and then you have the patient sit. Now, let me talk about one thing though. If you have a patient that can't come all the way to sitting or standing, that's okay. Let's have Kristen demonstrate that. So kind of come up as far as you can, and if they can't come up, you know, you're kind of assisting them up a little bit and pulling their flappers out of the way, and then assisting them back down. Okay? Same thing with standing. Let's have them come as far as they can come, and if they can't come all the way up, you may need to pull them up a little bit to get their flaps down, because not everybody can come to standing like that. Okay? All right, so let's move them to the recliner. So I'm going to hold on to your belt. Make sure it's secure. And we're going to move to the other side of the room here where the chair is. So see how nice and smooth this moves? So we're going to move them over to the recliner. And it's on the narrow setting. And it's going to slide right underneath that chair. Put your brakes on. All right, and now you're going to have them come all the way up to standing again. Move your little flaps. And then come back down to sitting. All right, and then I would ask my patient to scoot back in the chair. All right, and then I can move the Serosteti and There we go. That was easy. I didn't hurt my back. I didn't really, hurt anything. So the patient's safe, you're safe, and that's what we want you to do. So the Sarah Study is usually helping the physical therapy gym. If you need extra training on it, you can always have a physical therapist work with you on it. It's not hard to learn. It's a pretty simple tool, but it can save you a lot of trouble and a lot of backache too. So just let us know if you need help.